Today we have with us Dr. Reena Kumar, who is the Regional Clinical Advisor, Special Smiles at the Special Olympics Asia Pacific, and she's also a National Clinical Advisor for SO Bharat. She's an oral health care professional and has a 39-year of experience in teaching, administration, and clinical practice. Her clinical practice is in area of orthodontics, special care dentistry, sports dentistry, and pediatric sleep-related breathing disorders. She is donning many hats, but the most important for us is that she's a champion for Special Olympics. She has done many collaborations for Special Olympics, that is DCI, IDA, and many other. So let's hear it from Reena. Welcome, Reena.
Thank you so much, Mukta, for the very kind introduction. And it's a very warm welcome to everybody here. And thank you so much, Deepak. Thank you, Emma Shakila, Victor, Mukta, my dearest athlete, Ritik, and friends from all over the world, my athletes. A big warm welcome to everybody here. I especially want to recognize my mentor, Dr. Alan Wong is here with us. A very warm welcome to everybody here. And would you allow me to start sharing my screen now, Mukta? Should I start?
Please. Yes, please. Yes, please.
It's these very incredible times that we have been faced with. And so today it's a great moment that we have all come together and looking at various aspects where we can, take this day ahead and move on from here to larger grounds. So before we start the presentation, I would like to say a small prayer for the world to heal, and especially more so for the part of our country, which is really reeling under this, and a big salutation to all our healthcare workers, all the frontline workers, every person who's working there to make sure that we are all able to live a peaceful life and sleep in our beds. Thank you so very much. I bring greetings from all like-minded people who are involved in special care and the people and are involved in the welfare, from American Academy of Developmental Medicine and Dentistry, Special Olympics, of course, International Association of Disability and Oral Health. This is from all the chapters all over the world. We have friends coming in from everywhere, all the different associations who I cannot name here, Indian and international. So all who are concerned about this very fact, about what is really going to be the health and the healthcare concerns of our people with intellectual disabilities all around the world. Special Olympics Bharat has taken a great step ahead by taking this on and moving on to the digital world, innovating in and coming in with this webinar series of opportunities and challenges in training special athletes during COVID-19. I thank all of you for your interest and your care, and our athletes and all of us are totally indebted to each and every one of you who have spent your time here today to be with us. So I start with the reality of individuals with IDDD. So you see now, the world over, there are numerous people living with some form of the disability or the other, but up to 200 million people are actually there who are reeling under this situation. And we are all prone to human rights violation, and we are unable to access basic healthcare and educational services. And what is most challenging is that ID cuts across lines of race, education, social and economic background. And they are the most vulnerable population in any part of the world, come what may. Now, what is really the challenge over here, the health status of people? So if we have to come down, everything comes to statistics finally. But the information about the health services, or the presence or absence rather, is a reality. It's something which is just not there. Longitudinal data is non-existent. Besides Special Olympics, where we have our health data, very few countries have even included this population to have data and to maintain. So the GAPS says, is the World Health Organization says, that all this is basically because there's a breakdown in health, education, and healthcare systems, resulting in people of ID being forgotten or excluded from the mainstream. And this is, a lot of literature can be already put out, but basically it's just to tell you that the unmet healthcare needs among our people, among our athletes, among all people with intellectual disability is huge, and of which probably, besides the the actual problems which really come into eyes, there are so many comorbidities that our athletes face and our people with intellectual disability, with 90% being in the oral healthcare region. Along with that, there is constipation, sensory issues, issues with gait, spasticity. So you're kind of, we are more prone to falling and to injuring ourselves, seizures, sensory perceptions, not really being able to be present anywhere and everywhere. Not and challenged about having to adapt very easily to changing circumstances. Many of us are in cardiovascular respiratory predilections. We have an immune suppressed because we are taking large number of drugs and they're all interacting with each other. And all this is not because, our persons with intellectual disability die earlier because of the comorbid conditions, yes, but mainly due to poor access to health facilities, poverty, lack of health services, non-caring attitude, lack of clinical and didactic training in the management of health and behavior issues. So our doctors, our healthcare professionals, we are not adept. We have not been trained how to take care of our people. And so we are kind of scared. We are, even though we want to, many of us are hesitant because of the lack of training. So somewhere along, these are the issues. The education to our people with intellectual disabilities is what is reeling. When we were going through all this, came 31st of December 2019 and broke havoc. And this COVID-19 pandemic, which changed the whole world for us. It seems to be, well, if you look at it, it's just something like a flu. So it has fever, cough, shortness of breath. It seems so simple that, we really don't think, okay, we go through this kind of a thing almost every other day. But how does it spread? Coughing, sneezing in close personal contact, shaking hands, touching your eyes, mouth, nose after touching an infected surface or person. Now think about it. Look at our athletes. Look at what we do. We are so used to high fives. We are so used to hugs. We love to be close to people. We love to be, around. So now this is all changing. This is a new world coming up. Now we've been asked to stay home. We've been asked to do all kinds of things. So this is not so simple. It is a big deal. If somebody says, what's the big deal? It's only a cold, cough, fever, shortness of breath. It keeps happening and we keep walking off. But no, it's a big deal. It is a big deal. So how does COVID-19 pandemic impact our athletes and all persons with intellectual disability? So let's start with the mother of all centers, the Center of Disease Control and Prevention, which says, who are the people who need to take extra care? Besides the older adults, which is there, of course, we have a huge population in geriatrics amongst our people with intellectual disabilities. Many of them are already got illnesses and comorbid conditions, so they are in this. But as a group combined, there are people with disabilities. It's being put in and said that we are people who require. Special Olympics has responded. We have our health officer, the chief health officer, Dr. Alicia Bassano, who has responded in saying that people with intellectual disabilities are one of the most vulnerable population. But the important risk for people is not that it is the ID, it is the underlying condition, but the lack of access to healthcare. So again and again, it is being said, it is not because a person has intellectual challenge, but they do have, like each one of us have got comorbid conditions, but we have access to health. So there is a lack of access, there's a lack of education, there's a lack somewhere along in the preventive services, and this is what is causing a problem. Look what Johns Hopkins University brings out. And this comes up sometimes saying that COVID-19 poses unique challenges for people with disabilities. Of course it does. I mean, even for you and I, who we consider so-called in the neurotypical stream, it is a challenge. And for people with intellectual challenge or people with other disabilities, they are unique challenges which are being faced. Our Federation of Commerce, we have the whole economic country, the background of the economic country behind us. And this is also coming up and saying that persons with disabilities are at a higher risk of serious illness. So this is an issue which is to be taken very seriously. People seem to be at higher risk, people with disabilities, because, it is said again and again and again that is being said. Now, what is really the thing is the issues of pre-pandemic care delivery only becomes more urgent at a time of crisis, because people with disabilities have often not been considered in a disaster or pandemic planning. In the regular planning, we are always finding that somewhere along we have been saying that our athletes, our people with intellectual challenge are being left behind out of the mainstream of health. So let's do something, and we are always trying to move ahead, and Special Olympics has been doing a lot in trying to cover this gap. ADMD is coming up. There are like-minded people from IADH coming up, from all different specialties coming up, pediatric dentistry, ADA coming up and talking about this. Indian Dental Association. We have the, the Dental Council of India who have been so proactive in this. But yet, somewhere along in a pandemic situation where we have to take everybody along is where the barriers have to be broken, challenges have to be taken care of. So we have health environment challenges, we have the healthcare system challenges, the clinical practice challenges, the provider base. Basically, it's patient related and provider related. But I would say if you have to really break it down into two main points, it is the attitude of the healthcare giver is the greatest challenge. Undoubtedly, every research has shown that, I may want to treat, but I cannot because I do not know how to. I have not been trained. My curriculum was not tight enough. I was not taught that there is this population which has to be taken care of also. And in today's setting, we have to see whether the policy in healthcare setting during disaster and health crisis has been updated adequately and actually put to ground reality also. It is just not a paper document. So look at what comes out of the, I'm sorry, this is not showing up, but this is from the World Economic Forum. I don't know whether it's showing on your screen, but it's from the World Economic, no, I'm sorry. This is now showing up as the people with intellectual disabilities may be denied life-saving care. It is a very sad story. It's coming out of the Alabama, state of Alabama in the United States, where this is an extremely heartbreaking story, where Emily and Richard Wallace, they were the first Down syndrome athletes who got married and decided to stay alone. Richard died a few years ago, but the unfortunate thing is Emily died this year with COVID because she was denied a ventilator. Because our healthcare systems did not think that she deserved the right to have a ventilator. So this is the sad and really heartbreaking issues which are there in front of us. So if we today all have to join hands and sit down and actually look with our pen and paper and come down to it, what are the key issues? I would say that we would look at inclusive health policies for health equity and equality. We need to have access to information in every form which is available to every person. Mental, emotional, and physical well-being, even though, why do I write mental and emotional before physical? Because the psychosomatic factor, if you are mentally strong, mentally able, mentally happy, emotionally stable, you're physically well, you're able to overcome a lot. So our physical well-being depends so much on our mental well-being, which I'm sure our speaker in coming days, Chitra, will be covering. Access to care, medication and health, safety and security, availability of food and essential supplies. Now, this is what we have been told. Please stay away. This is the distance you need to maintain. Please cover your eyes, please cover your nose, face, up till down to the chin. Continue washing hands and please stay at home. Please stay safe. Please stay locked down. Now, this is our new normal. But when we look out from the eyes of our eyes, our athletes' eyes, does this seem so normal? It is pretty scary. Nobody's told me when does this end? How does it go? So in such situations now, it's important for me to sit down and type down for all of us here, what are our challenges? So what are the challenges encountered by our athletes and all people with intellectual disability? What are the challenges faced by caregivers, families, the coaches, and everybody else who are dealing with this? What are the challenges for healthcare providers and hospitals, clinics, for the community, for the NGO, for the organizations, for the policymakers and the government? So I would say for the athletes, it is the important thing is that we are so used to, our people with intellectual disability are dependent to many extent. Emotional and physical dependence is a great factor. Now, when we have been asked to say separate, so there is an amount of feeling of exclusion. There's a feeling of exclusion, stress, anxiety, fear, confusion, mental disturbance, and emotional health affecting our physical health. Up now what happens is that our athletes, we are used to a sports training ground, we are used to an everyday routine. Now when we don't do that, our physical health gets affected, we tend to gain weight, obesity comes in, a precursor of many diseases. If I fall sick, what is going to happen to me? Where am I going to get quarantined? If my father falls ill, if my mother falls ill, what's really going to happen? Difficult to follow social distancing. How are we going to stay away from each other? Is it easy for me to go and wash hands every time when I am dependent for every move? I'm wheelchair borne. I have got issues where I require some help to even walk. So there's going to be a close contact with my caregiver. There's a disturbance in routine. I'm a person with autism. I don't like disturbances in routine. So, there are these issues. And whether if I go to the hospital, am I going to face the issues that Emily faced? I have a fear whether I have health equity and equality. Is it really translated into action from paper is another thing. So for healthcare providers, I would say the challenges would be, how do we create more inclusive policies? How do we get down to putting these policies into action? How do we get more disability friendly? And how do we get more of the RWAs, the resident welfare organizations, associations, the non-government, not-for-profit organizations, all the people who are dealing with our people with intellectual disabilities to come involved in this and start working. So now the question comes is from the Economic Forum. It says, this has come out on 29th of April from the World Economic Forum, which is concerned about our population. It says, I'm sorry for all our international guests here today and our participants here, because we have many of our athletes here. Please pardon me if I break into Hindi vernacular for sometimes. So हमें अकेला लगता है. We feel lonely. Now, feeling lonely is not what a very nice feeling, because it says 45% of people usually report feeling lonely, whereas only 10% of the general population is reporting this. Now, loneliness, जब हम अकेले feel करते हैं, so then we have got, हमारे दिल में घबराहट होती है. We feel, we are sad, we are not happy. So we have a weakened immune system, and we are, we tend to get into stroke and different kinds of situations of cardiac diseases. ये Canada में हुआ. In Canada, what happened? Because they said social distancing. There was an athlete who couldn't go. There were many people who didn't know how to go and get their groceries and their necessity supplies coming from the places. हमें पता ही नहीं है, क्योंकि भी information ठीक से नहीं आया कि कब हम जा सकते हैं, क्या कर सकते हैं. Inability to quarantine, because behavior needs, हमारी जो necessity है, वो हम कैसे meet करेंगे? How in the world, अगर in case my mother or my father, I'm staying with a single parent, or I'm staying alone, what are my quarantine facilities? These are my great concerns, which the Economic Forum, the World Economic Forum, has brought it out. If we are in a care facility, what's going to happen? We are at greater risk for infection because we cannot have distancing. The social distancing is almost impossible. This comes out of the key policy maker, United Nations, which says that the risk communication and community engagement in a pandemic situation, in disaster management, where we need to disseminate information in simple and clear language, information in Braille, in sign language, large fonts, so that there's a text captioning coming up, video captioning, material which is going to be available for everybody to see, understand, and hear, and not an overload. World Health Organization comes in and says disability considerations during COVID-19 outbreak, and there is a lot of matter there, which says that हमें हम सबको साथ लेकर चलना है, हमने किसी को पीछे नहीं छोड़ना है. We cannot leave anybody behind, and we need to take, in a disaster situation, we need to carry the whole world along with us, and especially our people with disabilities, because this is the crowd which requires a special attention. What has our ministry done? This comes out of our Ministry of Social Justice and Empowerment, where a press release has been issued on 27th of March 2020, where COVID-19 is declared as a national disaster, and guidelines issued under the National Disaster Management Act of 2005, and the Section 8 of Rights of People with Disabilities Act 2016 has been evoked to include people with disability in disaster management. This information has gone from the national level to the state level to the district level, and this has been told by the government that you have to keep this in check so that every person with disability is included in it, and that we are taking this on till 25th of March. It was there, and now it has been extended, and this has been given as a dictum which has come out of the government. So now when we sit as healthcare workers, friends, families, coaches, doctors, and policymakers, we have to look, Am I going to only cry with the challenges? Is the challenges going to bog me down? Or do I find opportunities in these challenges? So the opportunities I could think of is innovation for inclusion. This is the time where inclusion probably, which has not been completed to our heart's desire, we need to innovate to create new methods to complete this innovation. Call in for leadership, a calm, prospective, introspective, anticipate, a leadership which is looking at the further actions to be taken, no knee-jerk reactions to be coming in. Creating and implementing new inclusive policies, disability-friendly community spaces and healthcare settings in hospitals and clinics. Information and dissemination, as I keep saying, is the most important thing, is the correct information. Education, that is the education which has to be accessible to everybody. Somebody who has got vision impairment, somebody who has, so it is in pictorial format, it's in braille, it's in large type, it's in big prints, it is in sign language, it is everywhere. And of course, a 24/7 helpline with broadcast in all languages. Engage with our SO athletes and all people with intellectual disabilities in our colonies, where we stay in our residential areas, to prepare them for the new normal. So remembering to say that this is not going away. Now this has come to stay, and let us accept this opportunity that this is the new normal. And now let's learn to grow, innovate, include, and create through inclusive leadership to get into the new normal. Enough and more documentation is there. There is a lot coming out of our government website, which is the Ministry of MOHS, Family Welfare, has got enough and more pictorial, and I'm quite sure the Braille as well as the sign language will also be out very soon. Inclusion Europe has got enough and more information, which is there in large print with good captions. Of course, our own resources, which we have been talking about, Mukta has been talking about, Victor has been saying, and each one of us have been saying that the amount of resources we have is incredible. The resources for athletes, all you need to go is to the website, click on each one of these, and there's a drop-down menu for coaches, for healthcare professionals, for sharing on social media, for youth leaders, for athlete leaders, for families, for programs and team leaders, and of course are also there for doctors when you come down. There is enough and more available documents which tell us how to stay strong with our Strong Minds program, connect with each other, get 8 hours of sleep, stay active, eat healthy food, use Strong Minds, meditation and yoga. Ask for help, reach out to somebody, talk to somebody, the helpline, the friends, the families, pick up the phone. Don't feel lonely. You're never alone. Staying fit at home through our Golisino Foundation, CDC. Yesterday, Victor spoke about this, and it was there. The School of Strength, which keeps us fit throughout. While at home, go in for using your siblings, play with your siblings, play with your family. So how do you spend time with your siblings? Enjoy indoor activities. All this to keep you mentally engaged, physically fit, and to be happy at the same time, because emotional wellness is the basis of everything. So now, as a healthcare worker, as a healthcare professionals, as all of us involved with it in some way or the other, would say, where do I go from now? So I need to make accessible, affordable, inclusive healthcare, which has to be available. Is it possible for all of us to run to the hospital all the time? Is it a good idea to crowd the hospitals? Because one, we may come back with more infections. So it is better not to go to hospitals. Move to teleconsultations. Stay connected with our families and caregivers. Make them feel that we are there. Give them a call. Tell them that we are able to speak to you, see the problems, speak to the athletes on videos, telephone, WhatsApp calls, SMSs. And of course, the most important thing is keep talking to everybody possible about the petition for rights of the people with intellectual disabilities and all other disabilities, because we cannot leave anybody behind in any other situation, more so in a disaster management situation and a pandemic like what we are going through today. But the most important, what I would say, is when this is over and when we all get back to work, when our clinics open, when the hospitals are already open and they're working, we have to know that our athletes have to know that there is a new scene now. Our doctors are going to look like space heroes. So we have to talk to them in a language. We have to make them understand that they should not be scared, because you're probably no longer going to be shake hands. You're no longer going to be able to do high fives. You may not even see your doctor properly. You may not even see where his, probably a blurring of the eyes is what you will see. So this is a little scary, but we need to kind of prepare our athletes for this situation. We need to innovate as to how are we going to go do teleconsultation with our athletes who are got vision and hearing impairment in addition. We have to go in how dentistry is going to change, because being a dental surgeon here, and I'm sure there are lots of dental surgeons here today with us on this forum that we are there, I will spend a few seconds on this. So how are we going to change the delivery of oral health care? I have discussed with my mentors, Dr. Steve Perlman and Dr. Alan Wong, who are here today, and I thank you all for your inputs and for your care in making sure that we are able to disseminate correct information. So the whole thing is about strengthening health education for prevention, broadcast good oral education material, because prevention is the way that we have to go. We have to make sure that we are able to prevent things, talk to them, broadcast it out in all readable forms, triage our patients through teleconsultation, attempt all aerosol-free procedures, minimally invasive slow-speed procedures, go in for electrical handpieces. There are many dental surgeons around the world who have been already using electrical handpieces which do not create aerosol. Use non-invasive procedures like silver-diamine fluoride, glass ionomers, staggered scheduling. We have to be ready for that, because there's going to be a big crowd finally, and people are going to feel, oh, why am I not getting to see the doctor? But so we have to kind of make sure that we are talking to them, and also looking at how we can cut out the infection control procedures, how we can bring in, the further infection control procedures inside our operatory. Now, the issue is about we have all been told, I have been told in India and many other countries, I think everybody has been told that when we go back to our offices, we are not to allow anybody except the patient inside the operatory. So this is a petition which has been taken up by American Academy of Developmental Medicine and Dentistry. And I'm sure in our country, luckily, I do not see a big problem about bringing in a caregiver to come along with our athlete, with the person with disability, into the operatory. And we will have to take great protection. But in many countries where they are very strict about it, petitioning for this has already started. Education training in special care dentistry is a must. Join as clinical volunteers for Special Olympics. Taste the magic of Special Olympics is what I always say. And you cannot go away. We have the Indian industry, the Federation of Indian Commerce and Industries behind us, which has been given out 15 recommendations, of which 7 of them are related to health. And it very clearly says that, there has to be people, and this is recommendations specifically for people with disabilities. So it talks about this. This is available on the net. If anybody wants it, I can always share this with us. Because of paucity of time, I'm not reading each one of them. The International Disability Alliance has given out 10 key points. Again, a lot of them related to health. So we are in the health grounds where everybody is talking, and there are people for us talking, but you and I can never stop talking just because there is some groups of people talking somewhere. But at every point possible, we need to be heard. We need to speak up for our athletes. We need to speak up for their rights. And we are not doing them a charity if we are giving them something, is what needs to be very, very clear. For doctors, there's healthcare professionals, there's enough training material on World Health Organization with telemedicine coming in. The government of India on 25th of March has drawn out the telemedicine guidelines and is going to put up a training program. So probably we need to kind of enroll in and learn about telemedicine. Special Olympics has health professional trainings. There are enough and more online trainings. We need to go in there, get sensitized, work with our local teams, join in with anybody, come in and taste the magic of Special Olympics is what we say, and you will never go away. We have a 3-series part, which has been coming in from the AADMD, which the next one is coming on 5th of May. There were 2 fantastic ones, so which we are talking about. And in 5th of May, Dr. Alicia Bazzano is going to be coming in and responding with Dr. Alan Wong is going to be conducting this session. So we have this, and I would encourage all people to please participate in this and be a part of this. So now what is it that we are actually looking at? What is it that we are actually looking at, and where are our issues are? So we need to look at data. Do we have enough data? If I ask how many people have been infected, when I look at the MOH site, when I look at the WHO sites, when I look at the various sites, there isn't any clear categorization that of people. There are states, there is age group, but there is much beyond age group that we really need to think about. We need to think about creating data, systematic reporting of what is the infection, what is the mortality rates, what is the disability status, what is happening in this group of people. We need to worry about how sports, health, and fitness of our athletes are going to be taken care of. How is the emotional support going to be ensured? How are we going to take care of physical health? Stay virtually connected. All the happiness activities, post onto Facebook, all the social media sites. Stay with family, sibling support. And most importantly, for all our people who are at jobs, to ensure that their jobs are with them, they continue working from home, feel involved, feel connected, feel important, feel self-esteem high, and do not lose their jobs, and should not be at a risk of losing their jobs at all. So this is a very critical part. The next concern of ours, which I say, is that it's a big concern, because there is going to be a day when we are going to return to play. There are going to be, it has been said world over, and in India especially, that 85% of our people are not really showing the symptoms. So if the numbers are not so huge, we believe it is not, maybe some reason because not enough testings have been done. The second thing could be because the testings were not required for those people. It was not suggested for those people because we didn't show those kind of symptoms. But yet we go in a subclinical manner and we are there, going through it. So if you go through this now, and what happens when there's a COVID infected athlete, when does this person can come back to play? So this is a huge concern, I think, from the sports desk, from the health desk, from the overall concerns from Special Olympics, and from every Olympic association, whatever be it, is going to be concerned about when does an athlete get fit enough to come back. Now from Lancet, there has been just recently, as 8th of April, there's been a publication from Hull, which says respiratory health issues in athletes facing the COVID-19 challenge. You'd be surprised to hear what it says. It says that people, all athletes who participate and who have had COVID, so when they recover, whether they're subclinical or they had a full-blown COVID, when they recover and they are sent back, so into exercise mode as to what they were actually doing right in the beginning, so they tend to get more chances of contracting respiratory diseases. Now, these people tend to have more of myocarditis. So the cardiac muscles are kind of inflamed. There's issues with the cardiac disease which comes in. So this is a huge concern. We need to be really looking at it and wondering as to whether we need to draw policies on this issue, because without data, how do we know how many of our athletes have even had some kind of an infection? Did they get past that? And do we go in a staggered fashion into the exercise routine? We are keeping fit at home. We are doing the Fit 5. We are doing the School of Strength. We are doing the everyday exercises. We are using siblings. We are looking after our fitness. We are looking after our mental health. But we want to go back to active sports. We want to run. We want to play. We want to get the medals. We want to do everything that we wanted to do. But now comes where the sports desk, the health desk have to meet. And we have to come to some consensus based on this as to how can we take our athletes back without jeopardizing their health, and more so their cardiac health, the cardiorespiratory health, which is of prime importance. This is our global strategic plan of Special Olympics of health, which has been a fantastic plan and has been a great plan till now, because we have taken into concern with healthy athletes to healthy communities. We have looked at 11 million people. We have looked at harnessing, universities, organizations, families, government, everything. We have looked at the tipping point. We have got access to this, medical professional training, inclusive. But now is the time for the leadership, the entire leadership, to sit down together, to actually think and ask ourselves as a team. We need to question ourselves and our team at every level. Get in the calm leadership in and say, what is it that is most important right now? What might it be that we are missing? How might things unfold from here? And what can we influence now that would pay off later, which is really critical for us? What is the ability that we have to anticipate how things might unfold? And the plan to act accordingly can help avoid knee-jerk reactions and poor outcomes. We all are being told today that this COVID is not going away. It's going to come back. It's happening in China. We don't know where all it's going to happen again, but we should be ready for it. that it's not going back. Probably it's come to stay with us and maybe they be there with us. We need to gear up. We need to scale up. We need to skill up. We need to see what is the new normal, accept it. And in this new normal, do what we are doing today. Virtual is the new normal. Go virtual. Leverage the digital technology for fitness, health, sports coaching. I'm sure we can do that. We need to innovate into this. I draw my strength from our athletes, just as each one of us here on this forum would draw. As I say, we will win because we are brave. We are brave. We will continue to be brave. And we are going to look at how we are going to not focus on our challenges, because challenges pulls us down. We are going to look at opportunities. We are just going to focus on what are going to be our rewards. How are we going to grow? How are we going to evolve? How are we going to get a better generation where we are going to be able to take on any challenge, whatever comes to us. And we're going to cultivate a compassionate leadership with purposeful innovations. So this is my presentation to each one of us with a plea and a request that every one of us, I may have put in a few points, but I'm sure each one of you will have so much more to add. We need to talk about it. We need to discuss about it. We need to brainstorm. We need to look at what is really there, because every region has its own challenges and its own opportunities. We need to collate them together. We need to work together. We need to join hands with like-minded people and take this ahead and become out stronger, as strong as our athletes are, and become winners. Thank you so very much for this very patient hearing.